The health tech ecosystem that the Trump administration has advanced looks very similar to the blue button system that we advanced in the Obama years. That is, the consumer has the right to aggregate the record, and you saw Microsoft announced this morning that it's going to make that freely available to every American, Copilot Health. ChatGPT announced in January with ChatGPT Health, and Claude announced in January. So you're going to see the big tech firms come forward. What's missing, and maybe this is a way for us to think about this, Emily, in terms of the role of the ACOs. We don't have digital public infrastructure for healthcare in a value-based way. Understanding if there was Epic Cosmos * Emily's ACO edition, where the health systems and ACO networks pooled their data in, maybe it's not 300 million, it'll be 100 million, because ACOs have smaller, but still not nothing. And that could be made available. It could actually get to the embedded protocols that may be cheaper to deploy without having to have data scientists employed at the individual ACOs. It's a governance question. If the US government doesn't offer a DPI, could a coalition of ACOs under your watch, has that conversation come up, Emily? I'm kind of curious if there's a desire to see the shadow AI work and then we want these to be cheap, is there a place to collaborate in that area?
So no, we're not having that conversation as much as I would wish for. And then your point about the three, there are three, the financial systems and financial data, that when I think about every single one of our nearly 500 members is what you prompted for me, contracting with some third-party entity to aggregate all the data, put the boats on the lake, and design and co-design some of those. So not taking it off the shelf, right? Because it's not going to be good enough off the shelf. You have a certain population that, even the blood pressure management, yes, the protocols are well known, the medical management is well known, but the patient engagement is very different, right? And so you're always going to need to put some of the thinking of the people who are caring for the patients into those models. But everybody doing that alone, it just feels like you just replicate the problem over again. I hate to be a Debbie Downer, but now you've got
no, we flipped it positive.
We do.
We can come together.
I don't think we're there yet because we don't know what are those three data, governance entities going to look like? What do they need to look like? But I certainly see the reason for the question, right? Because that's the promise of an ACO or ACO-like entity, which is they do have the data, that they're beyond the sort of payer data. They have a lot of data sources.
Yubin, flip it for me. Yeah. Go from sad, sad dude to happy dude. Tell me, if we got the David and Goliath story right, if we assembled a subset of Emily's Davids, and you were to engage with them in an open data kind of way. Now flip the question. It's not millions versus hundreds of thousands as a buyer, but actually a pool to learn from. Now, would you be positive if that's such a thing? If there was one of the three towers was a value-based care tower we could learn from?
I think so. So there are a lot of optimistic.
You should be saying yes. Yes, be positive.
Yes, it's possible, and I think we are heading there one by one. To some degree, it's maybe not so fast at the moment, but we can actually accelerate it. So to some degree, I think a public-private partnership is very important. To be honest, ACO business is very sophisticated, meaning that you need to make money while participating in deflationary movement. So there's a careful balance you need to maintain. But to some degree, I think so far, I believe, I don't know how many of you are working for ACOs, but making money in ACO is getting tougher and tougher every year. And the market doesn't seem like it's like a good investment you want to do it. But I think in many ways, if a government puts some more emphasis, you can still make money. Let's invest in. Let's put together to make this deflationary. If there is this push and the stable kind of opinions are coming down from the government, I think the market will thrive, I believe, and we have all the necessary components. Yeah.
Sam, you get the last word, but only if you're positive. Say something that you think is hopeful to get us to that.
Yeah, I'll have to really flip it around here.
No. From the India vision to now, let's reverse innovate.
So one, I just want to come back to a comment you made. It was so important. I think the cell phones were important. The networks were important. The tools were important. But you made a really important point, which is it all started with the government creating the conditions for those things to happen. So my feeling is that the government has an important role to play here. And if you have a legal structure and regulatory structure which solves only two things, what are the rules by which you can exchange data or provide data? And two, what are the rules by which you can actually use that data? Because you can imagine there's a whole bunch of de-identified data that can be used for finding care pathways. You don't need to know who it was. You just need to know what the condition was. And if you can have those two things solved for, the answer could be, the coalition of that ends up building one solution. To your point, you said the right thing. People can solve it, but you don't want to solve it 100 ways. So is it the coalition, is it the private industry investment which then comes behind it? My feeling is those things will happen. We are seeing a lot of really great development. You are honestly much closer to that the government is starting to think this way to create the conditions.